Well, good afternoon. I'm really happy for Lisa Mergens to be in our studios this afternoon. I've been wanting to talk to her. We've had several conversations on the phone about what she's doing in dentistry and how exciting it is. She's part of a company, part of a group, which is our payer team when we interviewed Deb yesterday from them. And I'm here because I invited her to Tampa because she's got such incredible experience in dentistry as a hygienist first for a long time she's been in dentistry over 3 decades.
Yeah.
Now she basically reinvented herself as a business development guru, and she can go into any kind of vertical in dentistry and kind of see, okay, here's what the challenges are, here's how we fix them, here's how you reach new customers. Business development, as dentistry goes through this transition of becoming more organized, and becoming a little more, because I think that the DSOs are driving that change. I think they're driving the change that makes new dentists or even dentists who have just one practice understand that we have to get our act together and we have to do everything right in order to succeed.
Absolutely.
Now, in the past, it was like, okay, if you had a practice around the corner, patients just came and they referred you a few patients, and it didn't matter.
Right.
We live in a day and age today where we've shifted to this mobile generation. Patients are finding you many different ways, online, offline. I mean, the old systems still work, referrals still matter, especially in your area where it's about specialists, right? So I'm excited to talk to you about this. I'm also excited to talk to you about the new venture that you are going to launch in the hygiene area, which is exciting because hygiene always excites me because all the years I have been in dentistry as a CPA, as a marketer, now as a guy who helps with call conversions with Patient Prism, the conversations I have with the dentists and the practice owners, sometimes the regional VPs of larger organizations. One pain point besides the front office, which is what we solve, that I consistently hear from everyone is, we don't have a control over our hygiene, right?
Yeah.
And if I had $1 for every time I said that, I have a lot of dollars. But it really is. I mean, I had this conversation yesterday with a group here that said, we need to really optimize our hygiene operations, and we have no idea what we're measuring. We have no idea what kind of, everybody's doing their own thing in their own place, and they have many offices. And so there's no process, right? There's no process that gets established that people can replicate. One of the things we talk about, and Linda Miles and I had this wonderful podcast about what do you do, what kind of advice do you give to growing practices that are, establishing a larger footprint in an area. And one of the things she said was that you have to have a system. And once you establish a world-class system, then you have to learn how to replicate that. Now here you have an office, a company with a DSO with 25 offices, and they have acquired them over the course of the years. They have their own systems. And if you don't really have anything consistent, you're not going to succeed because nobody knows what they're being measured, what's being measured, and what's expected, and so forth. So hygiene is an area that I absolutely, I even will ask a dental practice. I said, before you even decide to do anything else, do you have a hygiene department that functions at its best capacity? Are your hygienists really good at uncovering all the problems and having those discussions and developing rapport and detecting periodontal disease and being comfortable with it and all that stuff, right? So are they comfortable? Are you or are you at 10% hygiene revenue and then you're wondering, do I need to buy a CEREC machine, right?
Yeah.
And you're not fixing the basics. And I think it starts with hygiene. So
what I'm doing now with my partner, Nicole Fortune, which is called Ascendant Hygiene, doesn't exactly address that.
okay.
But in a roundabout way it does, because the object of Ascendant Hygiene really is to promote and the education and the forward momentum of the hygienist out there. And by doing so, we're giving a platform for the hygienists who are the movers, the shakers, the innovators who are working towards goals other than, your 45-minute prophy. And so we are assembling a group of professionals across the nation who will speak on our platform. And the idea is to initially set it up as 30-minute podcasts and bring in these voices, these new, fresh voices, so that these hygienists who are in their operatories are hearing about the changes, hearing what's going on, being kept up to date, being motivated to do more, being motivated to be better, being motivated to offer more to their patients and to their practice. And so whether it's from a clinical point of view or a business point of view, teaching them and inspiring them to be more and be better is what we're all about. But to that end, also, one of the things that we're doing is we are assembling about 20 different unique voices in our profession. Wow. And they will be assembled once a year in a dental hygiene idea festival. Where wow. We are sequestered basically for 2 days.
Nice.
And we will come in with an agenda of topics that need to be discussed. And we will discuss, debate, have discourse, and find resolution to these topics. And at the end of our 2 days, we will then put out a position paper.
Oh, very nice.
On all of these issues. And this brain trust, if you will be in position for either 2 to 3 years.
Right.
And at that time, they will be replaced with another 20 voices, 20 fresh opinions, 20 fresh idea makers and movers and shakers and people who can bring another voice to it. And Nicole and I, in our role there, having created this, will simply be the facilitators of this. So that's our Dental Hygiene Idea Festival for Ascendant Hygiene. So we want to really be the people and the place that hygienists day to day can go to find updates, to be inspired, motivated, and to propel themselves forward. Now, transitioning them all into what you were saying a moment ago about where the pain points are in the dental practice, if we can bring these hygienists on board, if we can spark a new interest, a new passion in them, and have them re-engage with their practice and re-engage with their patients and their profession, then haven't we done something amazing for all?
I completely agree with you. Actually, it would help hygienists because I think one of the things that I've talked about is hygienists need some leadership courses. They need to really understand that they are leaders in their silo, if we may call it.
Yes.
And we'll talk about silos a little later. But hygienists truly have the most opportunity to engage with the patient.
Well, and we were talking earlier when I was interviewing with Debbie about recently a thread that I was on with hygienists wondering what they could rename themselves instead of registered dental hygienists. And I read them all, and I was telling Debbie, I was sitting there going, don't do it, Lisa, don't do it, Lisa, don't do it, Lisa. Gosh darn it, I had to do it. And I jumped in there and said, why do you need to rename yourself? What's wrong with who you are? Be proud of who you are. Right. It's how you compose and comport yourself. It's who you present yourself to your patients and your practice and your boss and your coworkers. That's who you are. If you show an air of authority, if you show that you are a professional who has value and can add something to the patient experience and to the patient's treatment, then everybody will respect you. It doesn't matter what you call yourself. So be happy with who you are.
You're right. You're absolutely right. I think they probably need to embrace what their role is in the practice better.
Well, and move it forward as possible, and within the scope of practice law by, state by state. And then maybe we can all start working towards getting a national licensure so that state by state we can all practice the same way.
But so the brain trust in hygiene will be comprised of hygienists that have innovative ideas in how
Yes.
they practice?
In how they practice and who they're practicing for and who they're reaching out to. So whether we're dealing with community outreach or, assisted living communities or, access to care issues or hygienists who are out there using, the lasers in dentistry and how they're utilizing it, if they're working in business development or if they're working in the underserved population. So people who have stepped outside the box or maybe created a new box.
Right.
Which is what Nicole and I have hoped to have done, is create a new box with Ascendant Hygiene.
So maybe inspire them to do more than what they're doing. Is that what it is? But what about what they need to be doing at their very basic? Are you guys going to cover that? That we should be at least doing this, right? Because sometimes the prophy mentality unfortunately exists.
Prophy queens.
In all of hygiene. So how about, would you have discussions on, guys, I think this is the base, right? This is who we are supposed to be at the base. And then we start with that base and then we're going to move forward from that point onward.
Well, and that goes a lot towards what I was speaking about when you first came in, and that's always treating optimally and presenting optimal treatment. So that goes to the dentist as much as it does to the hygienist. Why would we want to have preconceived notions about a patient? All patients have to go through a certain channel of procedures to have optimal dental hygiene care. So yes, we can speak to the base of that,
right,
and then move from there.
Right, because I think most, I couldn't speak for all the hygienists, obviously, but I think there needs to be a baseline expectation that hygienists create within themselves. That
I agree.
I'm not going to be, because I think a lot of times people get stuck in no matter who they are, not just hygienists, but dentists, CPAs, whoever it is, we get stuck in our ways. We just continue the same thing over and over again, and until somebody comes and jolts us.
Well, and that's what Ascendant Hygiene is looking to do. It's looking to inspire, these hygienists to
push the frontier.
To push the frontier, exactly. To push it, to reach for new heights, to ascend, if you will, within their career. But forming a baseline, that's a no-brainer. I would love to get rid of the prophy queens of the world,
So what about, would you also address in Ascendant Hygiene, I've talked to many hygienists across the country, and one of them I was talking to just earlier last week, and she really wants to graduate from her role to more practice management, because she's really learned all the different silos and because she has climbed above them, as you say.
Yes.
She's jumped over the silo and kind of looked at how the practice works, and she's absolutely incredible in terms of her thought process. She said, I think I can bring a lot to this practice from what I have learned as a hygienist, but more than that, I've learned to look at the team from my perspective and teach practices. So is that going to be part of somebody in Brain Trust? Will they also teach hygienists to jump the ship, for lack of a better word, into maybe doing hygiene part-time, or maybe leaving that to go ascend to new frontiers?
Absolutely. There's hygienists who are out there doing forensic dentistry.
Right.
There are hygienists out there who are, in microbiology labs right now studying bacteria. There are hygienists out there working in hospitals. There are hygienists out there doing, working with indigent children. There are hygienists who are out there working as CPAs.
Wow.
There are hygienists in every walk of our lives doing new and amazing things. We just don't know about them.
Interesting. And that's one of the I guess you'll find them, I guess.
We will find them, and we have been finding them. And Nicole and I have spent months on end literally seeking them out. And it's so funny because there's like this whole little underground web of these crazy, awesome hygienists. And when you find one, all of a sudden, and you get excited, and Nicole and I have these conversations much like you and I are having right now with them, and these discovery conversations and learning about them. And we get so excited, and then when we're done, we ask them, will you be a part of this with us? And, I've not had anybody say no. And when they do, then our next question is, who else do you know?
Right.
Who do you know? They might not be you, they might not be doing what you're doing, but who do you know that's out there banging a drum that isn't necessarily getting the voice.
Well,
And so that happens.
well, if you want us at our studios here, if you want us, part of Patient Prism, to tell their story, we certainly don't mind welcoming every one of them here.
Oh, that's
and,
lovely.
and telling them story for your Ascendant Hygiene. They can come in saying, I am a hygienist. Here's how I'm pushing the frontier. Here's how I went from here to here to here. Right? And we could easily do that, because one of the things we're trying to do at Constant Coach is really open everybody's eyes in dentistry. No matter who you are, in what silo you belong in, we want to open everybody's eyes to better education and empower them to make the career choices that are perfectly suited for them.
But not only that, Amal, think about the patients we can touch.
Right.
Think about the lives we can affect change in. Think about, the people laying in skilled care facilities who aren't being treated dentally. The conversation I had with Debbie earlier is that there are federal dollars mandated to make sure every patient going into an assisted living facility has a dental exam and evaluation. And these care facilities choose to pay the penalty to not do it, rather than to provide a practitioner, a hygienist there, to do their oral health care assessment.
Absolutely. And I think a lot of hygienists would if they are involved, even if they don't decide to, they work, let's say 4 days a week at a practice, and then they have this project that they decide to do on the side, it's going to invigorate them to kind of be better at what their job, because now they're giving back.
There's joy.
And exactly, they're finding new meaning and purpose.
There's joy. There's joy in it. Or hygienists like me, 10 years ago, I fell deathly ill. And it's the only reason why I stopped clinical practice. I had no choice. And so I had to go back and reinvent myself. And, who is Lisa now? Right. And what can Lisa do? And what can she bring to the table? And, had that been available to me 10 years ago, like it is now, I would have jumped into that realm. But now there are those hygienists who are feeling the aches and the pains, and their body has taken a beating from years of practicing clinical hygiene.
Sure.
So aren't these the greatest people to move into this treatment modality, to do these assessments on these care facility patients, and to provide them the basic oral care that they so deserve, that can extend their lives, because we're affecting their oral systemic link.
Obviously, and the oral systemic link is becoming more and more relevant as the science progresses. AOSH is doing a phenomenal job at this, and I think it's going to grow over the next decade significantly.
Well, it has, and we were talking oral systemic 35 years ago when I was in school. Right. We were talking oral systemic. It hasn't changed a lot. There haven't been, we know more, right, but we haven't done more yet. And so that's where we need to be. And we really need to create critical care teams for our patients with the dentist and the medical doctors together.
And the reason it has happened until now, and the reason why today is different than 20 years ago, is there is professional management in dentistry today.
I agree.
And the guys who are business folks, and I love all of them actually. Most of them are wanting to do great dentistry. The dental entrepreneurs of today. And they truly are looking at everything. They don't have blinders on. They're looking at dentistry from a multifaceted angle. Obviously, they're doing a lot more. General practitioners today are doing a lot more in dentistry than they used to do 20 years ago.
Sure.
But they also are trying to figure out what else they can do to obviously earning revenue is one part of it, but maintaining the loyalty of patients, right? I had asked this question to somebody a few weeks ago, is how imperative it is for a general practitioner today to offer some sort of oral systemic type services, whether it's oral saliva testing, whether it's oral cancer screening, whatever that might be, whether there's some heart markers that you can test for.
Well, and the funny thing is, Amal, is that the hygienist has been doing that since day one. We haven't been billing out for it. Now, we haven't always been doing the saliva testing. That's more recent. But in terms of, the oral cancer exams, educating patient on oral systemic issues, we've known cardiovascular, back in the 80s, Evanston Hospital up in Chicago, which was part of Northwestern University, Evanston Hospital had patients clear for cardiac surgery through the dentist and the hygienist on staff at the hospital. Those things were happening, 30 plus years ago. The hygienist was doing it. But it wasn't until the dentists came in and said, okay, that we now have the AOSH of the world.
Right.
And that's okay.
It's okay.
It's okay because now the voice is there. And now we just have to speak loudly so all can hear. And we've done a great job in educating people on regular oral health. We've got all of our toothpaste commercials, and we've done a great job in educating people on pediatric oral health.
Sure.
So now it's the oral systemics time. And so that's where I would love to see our organized dentistry and our organized medicine and all these other companies come together and start putting that message out on the commercials and the billboards like they did for everything else.
But I think that the only way that will happen is if one of these big companies has a product that they want to sell. That's the only reason why ads get put up, unfortunately. And I have a big gripe against pharmaceutical ads because if you see the number of prescriptions that were written, looks like the number of prescriptions that were written last year versus 10 years ago, it has doubled, or 5 years.
Right.
The number of prescriptions, and it all relates to the ads.
Absolutely.
That's my little
well,
sense on the ads.
One thing Nicole and I have maintained, and it will be the end of Ascendant Hygiene if it ever changes. Yeah. We will never be the mouthpiece for any of our professional organizations. We will give them a voice to be heard, but we will never be regulated or their mouthpiece for them.
Right. I mean, there's no reason to endorse.
There's no reason to. We will not endorse any product or professional organization.
Correct.
We're not going to be the mouthpiece for the ADHA or for the ADA or the AAP or anybody else because we want true voices being heard and spoken. We don't want voices with an agenda.
Well, it's great. I mean, so again, my offer is on the table for us to bring these voices. And we will get these voices heard across the world to inspire hygienists to be the best they can be and ascend from where they are, because everybody can ascend, right? No matter where you are. Bill Gates can ascend.
Absolutely.
And he keeps on ascending every day.
I know, right?
By the way,
cha-ching.
A billion here, a billion there. But everybody can ascend at any point in time because it's all about growth. This is very exciting, and we'll continue talking about that as you launch this. And I wish you the best for that.
Thank you so much.
I think it's fabulous to have discussions. I think every area in dentistry needs new innovative ideas.
Well, I would love to invite you to join our Brain Trust if you would like to.
Well, thank you. Well, I don't know how much hygiene I can contribute, but I think I can certainly
you can help facilitate.
Lead the discussion. I will facilitate for sure, because I will come from a point of knowing nothing, which is also a good point because I don't have preconceived notions about anything, right?
Yes.
So I will look at this from a business consulting eyes and say, here's the thing, right? Here's what you could do, and if you're telling them that this is you got to look at life in terms of in a different lens every single day, because every single day is a new opportunity to be better. Every day. And I look at my life in terms of that. What can I do today better? One of the things we have been producing content, and as Debbie knows, at the speed that nobody else is producing.
I know, it's ridiculously awesome though.
And it is, I think that the idea is to, again, very similar to yours, is to have conversations and let people be inspired by these conversations, whether it's you or it's somebody else who is in the seat. And I'm like, oh my God, this is a great idea. I want to be part of it.
Yeah.
And we will create the network to distribute this all across the world. So I'm excited about that. So let's change topics a little bit.
Okay.
I know you've been talking to Debbie all morning. I want to kind of understand from you this idea. We talk about leadership a lot in dental practices. Mm-hmm. And leadership means, I think, it was General Patton no, it was John Quincy Adams who said, when you do, when you when you put the interest of somebody else's, I'm paraphrasing, above
your own,
your
yes.
own, you're a leader. So you don't have to have a title, as Simon says. You don't have to have a title. It's not a rank. It's about giving something up for the benefit of others.
Right.
And the whole, our slogan, the people before profits, came from that, is that you really have to look out not just for your patients but your team members. You have to look out for and in return you get that back in multiple ways. So you say it similarly in leaving your silos comment that you made earlier. Everybody seems to be in a silo in a practice or in life, but we're talking about dental practices and the hygienists and the assistants and the dentists, and everybody's kind of doing their own thing and has this vision of, here's what I'm going to do, and this is what my job is, and I'm going to do it, and I'm going to get out. Right. And so talk to me about your ideas of leaving silos and silo jumping, because this is the first time I've heard it, and I'd love to hear that.
So the idea of working in a silo, you've heard of. Right. Everybody's heard of the silos. And yet sometimes we're in a situation where we say, there are no silos here. And that's in a communication response, So there should be no silos when we're talking about an office communicating with each other. Everybody should always be in the know about everything. But yet silos do exist department to department. So if we're talking about a dental office or a hospital setting or, a corporation, there are silos, within each model. So the idea is that we jump silos. Okay. And so we kind of are silo watching. We go to the top of our silo and look down and see what other people are doing. Nice. Or maybe we go and visit their silo for a little while. Oh, nice. Okay. So you can talk about cross training and things like that. But you know what? Quite frankly, a dental assistant can't cross train to be a dentist or a hygienist. Sure. She can't. But boy, she can certainly have a conversation with the hygienist about what makes your job so exciting, or what makes it difficult for you to get through the day? Where are your challenges? Where are your happy places in the course of a workday? What makes hygiene wonderful for you? And she can have that same conversation with the doctor, and the hygienist can. And it's literally just sitting there and asking the question and hearing what the other person has to say. Because as long as we all feel appreciated and valued in the work that we do from the other silos, it makes it easier to work together as a team. So knowing that the front desk cares about what's going on with the assistant makes the two of them get along better. They're not doing each other's jobs necessarily, but they are certainly empathetic to the day-to-day ins and outs of that person. And they're more willing to be helpful towards one another, more compassionate towards one another, and to then take all of that those feelings and those emotions that go around with that empathy. Right. And what does that translate into, Amal? It translates into a better working environment. So you're getting joy working, but it translates into better patient care.
We talk about empathy all the time in Patient Prism. The first thing we talk to all our front desk receptionists there and our coaches who actually guide them is it's the most important thing you have to have is empathy. Yes. You have to put yourself, if a patient's calling looking for an extraction, you have to ask if they're in pain. Yes. And what you can do to help them at that time. Yes. And if you cannot connect on that level with them, then you should not be in this field, because it really is, you are changing lives, you're making people going from a worse place to a better place. Mm-hmm. And why not have empathy with everybody in your life? Mm-hmm. I think it would help us significantly, professionally and personally. Empathy with your patients when they're on the phone, when they come in, when they're being presented treatment. All of that matters. Hygienists obviously play a big role in terms of that. But everybody, right? Everybody has to put themselves in the shoes of, if there is a elderly woman having a trouble walking so somebody needs to hold her hand and take her to the thing. You have to empathize, because what if it was your grandma?
I've driven patients to and from home before.
Right, exactly. And I think empathy also matters. What you bring out is an interesting point, is you have to empathize with your coworkers and your team. And that's what I think you mean by jumping silos.
Yes.
Is you sit with them, you understand the similarities you have with them, you understand the differences. And when you sit down and you talk and you explain what your challenges are and their challenges are, and I think it obviously people just don't know you until they know you.
And we don't have to fix each other's challenges, but we just have to be recognized that we have them.
Right. And I think when somebody else appreciates what we do and somebody else understands how, no job is easy. Every job, to do it right, takes effort, takes professionalism, takes education, takes commitment, takes consistency. All of that
grit
stuff is
and gravitas.
Hard, right? Grit and gravitas. That's right. And it takes, and everybody has to be appreciated. Every position has to be appreciated, because this is a team. You're from Chicago, so Michael Jordan couldn't win all the games. They had to have everybody else.
We let Scotty in.
We let Scotty and everybody else, and everybody had to contribute, right? He could score 50 points, but they would still lose. So it's not about Michael Jordan or the dentist in that case running the show and trying to hit 3-pointers or being the guard there. Everybody has to perform,
and on the same message. Always on the same message. And when everybody works towards creating that message, then they can all believe in it, buy into it, and express it to the patients that we're fortunate enough to treat.
So you said something earlier, Debbie, that really stuck in my mind, is that everybody's got to be on message, on point all the time.
Yes.
With every patient, every hour, and never sway from that, right?
Never.
You have to have, and that is when you see patients start trusting your practice, because everybody's behaving in the same exact manner.
Absolutely.
And there's no inconsistencies. I've always said this in my interviews, is that the moment, whether it's all the businesses that I have started in my life, and I've seen that if a client of ours, if we don't speak in my CPO world, if my entire team didn't speak in unison in terms of the strategy that we're recommending for them, they get scared because there's inconsistency.
Amal, you have children.
Yes.
I have children. Now, I don't know about you, but I know in raising my 3 children, there have been times where I have disagreed significantly with my husband, their father, on what was about to happen or what did happen or how it was about to happen. The consequences to their behavior. You know, my children were raised with one piece of knowledge. Your actions determine my reactions. But the point is, no matter what, as parents, we have to put up a united front. I may not be happy with the choice my husband's making and how we were reprimanding our children.
That happens to me all the time.
Well, exactly. But my point is, I may not be happy or he may not be happy, but in order to show the united front so the kids aren't getting mixed message and to raise productive members of society. So it's the same thing into patient practice, you know? We have to provide that united front, always be on message.
And you know, and I was talking to Deb yesterday about how expedient we are in hiring people, right? We just need a body to work. You know?
Oh God,
everybody says all the time. I mean, I get this. Oh, we need 3 hygienists. Like, okay, well, wonderful, that's great. Let's put that up. And now it's easy to put that up because it's online. ZipRecruiter puts it on 50 different boards. You put the same ad, and then you get the same person, and you wonder what happened. There's no process. Nobody explains it. It really, dentistry, and I every time I get an opportunity, I get it all the time now, but every time I get an opportunity, I tell the solo practitioners, the guys who it's wonderful. I think we need to have both sides. The corporate world is great, but not everybody's going to choose that world. I think we should always have enough choice in America for people to choose who they want to go to. And some people want to just go to their neighborhood dentist who they trust, who's part of their family, who they can, and some people want to go.
And everything has a season. Sometimes it's the season for the corporate dental office because in that moment in your life, that's what you could do.
Right.
That's what you could get to. And that's what worked for you in that moment in your life. Would you be happier being in a private practice with somebody that you've had an established relationship with, that you can count on to be there when you come back in 6 months, that isn't going to have moved on to the next greatest thing that they're going to? Yes, you would. But in that moment, in its time, that larger group situation worked for you. It has its place because people are having access to care there.
Right, absolutely. And they're evolving too. Because the groups of the past are not groups of today.
I agree.
Right?
I agree. And there's lots of little groups.
And a lot of little groups too. And then they're not. We can't all club them as corporate today.
No, there's
because
not a blanket.
A lot of them are trying very hard to stay localized.
Very much so.
Heartland does that very well. Pacific's doing it really well.
Mm-hmm.
So a lot of the big guys, it's not that these guys are corporate greedy chieftains that are out there to just make a lot of money. I think they also want to facilitate abundance in dentistry.
I agree.
And making care, as Fred Joel would say, faster, better, and cheaper. Right? And sometimes that doesn't jive well with the professional community of like, oh, this is not a product, it's a service. But I think as I think group dentistry, I wouldn't say corporate dentistry, group dentistry is here to stay. It's evolving pretty fast.
Listen, yes, there are wonderful auto mechanics out there, and there are auto mechanics that'll gut your car for you and you didn't even need it. Same thing with podiatrists, dentists, lawyers, Indian chiefs. It doesn't matter who they are. There are the good, the bad, and the ugly.
Right.
And so it could be the solo practitioner that is working at a less than ethical level compared to the group dental practice around the corner. We don't know. And so, patients have a choice.
Right.
And aren't we fortunate to be in a country that we're given a choice?
That's right.
So there's plenty.
It's the evolution is so fast in dentistry, and I think I heard from the ADA meeting which just ended. There was a lot of talk about the rapid evolution of dentistry, and the rapid advancements in obviously not just technology but business practices that are evolving. And professional managers are coming in and looking at dentistry from, okay, what are the problems and how do we fix them?
And it's wonderful to have the professional managers in there. It really is. When I work in business development in dentistry, originally it was working within a surgeon's world and putting together coursework for them to go out and teach, live surgical courses and, creating all the collateral marketing material and then, getting it out to the general practice dentists, that they wanted in the seats. And so there was business development in that. And so, then moving into general dental business development,
Sure.
It's a matter of taking a look at everything, whether it's their marketing, their culture, the different options, expanding their repertoire and what they can offer their patients, investing in their staff to do more, be more. Those all are very important things. And so having these managers come in, from the corporate world and looking at dentistry as a business.
And from a problem-solving standpoint.
It needs to happen. It needs to happen.
We came here, we became a business by accident. The Patient Prism was an experiment. Right? We just wanted to solve a problem. We didn't want to create a business.
I understand.
Happened to be a business now.
Neither did Nicole and I.
And we're like, all right, we see a problem. We see it's not been fixed before. Yeah. And we can find a better solution that actually fixes. And that's right. Which I'm very proud of my team.
It's wonderful. Well, Nicole and I were having the same thing. We're sitting there going, we're hearing the same voices. We're hearing the voices I was hearing about and reading about 30 years ago, 20 years ago, 25 years ago. I'm hearing the same voices. There are other people that need to be heard.
Absolutely.
Let's give them a platform to be heard. Let's give validity to what they're doing.
And it's all about the platform because we live in an era. We've always lived in eras, but today, because it's easy to to get the message out. We have a unique opportunity to get ourselves virally spread across, but still the mainstream, I guess I would call it media, not just as in the channels.
Sure.
But what happens is usually only a few voices get heard in any field of life, right?
So
only a few, and then and those voices may not be the most competent voices out there,
right?
But they just have a better way of distributing the voice, or they have a better way of they may have charisma in whatever it is they're doing, but and you hear their voices better because you think that's the voice, and there are people out there that are hidden gems all over the place.
So how fortunate are we, Amal, that we get to uncover these people?
It would be fantastic. That absolutely. This fits within what we want to do in dentistry. Is to get the voices heard of everybody who has something to say that advances dentistry for everyone around the world.
Well, yeah.
And we are going to do that. And I appreciate. And this is great. I had no idea before you came here. This hygiene project and the Brain Trust was going to be part of our discussion. And I'm incredibly excited to help you in any way to get this going together, and definitely we will make sure through our platform we get these voices heard.
I'm thrilled.
So thank you again for showing up from all the way from Chicago.
Yes,
I'll be in your hometown tomorrow.
All right.
And we'll continue the discussion and let us know what we need to do in terms of getting this going. Anything we can do, obviously we'll be here. And then I'll let you continue your discussions with Debbie on many things, including I definitely want you to cover this developing a referral base for specialist topic.
Yes.
Because we are talking to a lot of specialists, periodontists, prosthodontics, oral surgeons all over the country. And they definitely are, they definitely need ideas on how do you set up the ground game? What do you do? It's not just about, okay, let me go get a website and get all this stuff done. Yeah. We want to make sure that you have to have a ground game.
You have to have a grassroots.
Grassroots. That's what in politics we call that, right? Grassroots ground game. You got to go knock on the doors, and not necessarily, but you have to have something that is in that realm where you establish yourself as a trustworthy surgeon in the community that is going to out there, right? Endo guys ask me this all the time.
An air of authority, that you are the be all, go all to person that people want to send their patients to.
Absolutely.
And it's about forming a cohesive, multidisciplinary team with your general dentist. That's what I was speaking with before. So you've got your specialists, you've got this interdisciplinary team that works together for the betterment of the patients. Well, who doesn't want to put their patient in that person's practice then?
Right. And then in light of, if you don't mind addressing, a lot of specialists do feel slightly disrupted by the general practitioners who now are able to do a lot of things that specialists did. People are doing endo, they're doing ortho, they're doing all the stuff. So there has to be some sort of a communication established for a specialist with the general practitioner of, here are my boundaries, here's what I do, here's what you do, and here's how we're going to work together.
I'm happy to speak to it.
That'd be wonderful. Yeah. Thank you so much.